Hi everybody, this is Adam, the geneticist from Verdure Healthcare. So today I'm going to do a very special talk on gender selection to avoid serious disease. Now, as you might realize that I've put on hold my chromosome 13 part 3 because we have received 2 consecutive reports that indicate the same disease requiring our client to choose a certain gender in order to avoid serious disease in their children. So I think there is an urgency for me to actually slot in this talk before the chromosome 13. Alright, so just to give you a sort of like a refresher, there are 2 main types of genetic disorders. One is the single gene disorder, whereby we zoom in very, very small, and then we see the pieces of DNA, and unfortunately those pieces, they have been missing, or they're being replaced with something else that shouldn't be there, and that's how diseases are generated. But on a more obvious level, there is chromosomal abnormality, whereby this is on a bigger picture level whereby the whole chromosome is having an issue. Okay? So the difference between chromosome and the DNA is that, okay, all humans are made out of cells, a lot of cells. So within there is a command center called the nucleus, and within this nucleus there is chromosome. In fact, there are chromosomes, because there isn't just one, okay? So if you pull out the contents within this chromosome, you can see the DNA, or so-called the genes in there, all right? And then these genes are made out of the DNA fragments, okay? What we call the nucleotide base pairs, okay? This is a fancy term, all right? Whereby you will be able to see the combinations of the DNA, and that's how we look into if you are a carrier of any sort of disease. Okay, so humans are made out of 23 pairs of chromosomes. And as you can see, from the first pair all the way to the 22nd pair, they have to be identical, all right? So these are called autosomes. And now today, we're going to focus on the sex chromosome, and that is going to be the 23rd pair. So if you are a female, you should have 2 pieces of X chromosome, and they better be identical, all right? And for males, all right, you should have 1 X chromosome, and the other piece will be a Y chromosome. So a long chromosome and a short chromosome is normal for a guy. Okay, so now we're going to talk about these diseases that will be affecting a certain gender. But before we go into that, let's have a look at what determines the gender of the baby. It will be the father. So because the mother will have 2 pieces of X chromosome, and so she can't contribute anything else other than X chromosome. But that's different for the father. Because he has the Y chromosome, there is a chance that he might be contributing the Y chromosome for his offspring. Okay? So as you can see, that's how things can happen. So X chromosome, that's how the mother contributes for the offspring. And if the father contributes the X chromosome as well, that will be a female child, all right, a baby girl. So if the mother, since she can't contribute anything else anyway, the other piece of X chromosome, but when the father gives out the Y chromosome, this will become a baby boy. All right? So now, today, we're going to talk about X-linked dominant diseases, all right? So, as you might recall in my previous talks, that genetic diseases can mainly be separated into dominant or recessive diseases. For recessive diseases, that's the majority of the genetic diseases we have talked about, whereby it requires 2 pieces of the chromosome to have the same mutation in order to cause the disease on that particular person. Okay? But for X-linked dominant, you don't have to have a pair of broken chromosomes. All you need is just one, okay? So one of those chromosomes is enough to cause you the disease. And that is called the autosomal or the sex-linked dominant genetic diseases. And that is a very serious concern for us because we have received consecutive DNA testing result indicating X-linked dominant situations. Okay, so let's talk about if let's say the mother has an X-linked dominant disease, okay? She will be affected because all you need is just one of those mutated chromosomes. Even though that she has the other X chromosome, that is fine. And the father is unaffected, okay? So the father is carrying some other kinds of genetic diseases, but it doesn't really matter because he's only a carrier. So in this situation, first of all, we need to manage the mother's condition. So whatever kind of X-linked dominant disease that she is having, we have to manage this disease. So either via diet control, lifestyle changes, or on a more serious end, we have to send her to a specialist. All right? So in that case, let's imagine the scenario. If let's say the mother contributes the clean chromosome for this girl over here, and the father contributes his X chromosome, which is also clean, for this child of theirs, and this will be an unaffected daughter. All right, so she is completely fine. She wouldn't be a carrier of these things, and yeah, she will live a happy life. But if let's say the mother contributes the affected chromosome for this baby boy over here. Right, so since this is X-linked dominant, it really doesn't matter what the father contributes, but in this case, he's contributing the Y chromosome, which makes their child a male. But once again, since this is dominant disease, this baby boy will be affected. All right? And if let's say the mother contributes the same chromosome, the affected X chromosome for this baby girl, even if the father contributes the clean X chromosome, this baby girl will still be affected. All right? But how about this better scenario? The mother contributes the clean X chromosome and the father contributes the Y chromosome. It will be an unaffected son. So in summary, as you can see, if the mother has an X-linked dominant disease, not only that she herself will be affected, there is a 50% chance that their offspring will be affected as well. But on this particular level, it really doesn't matter which gender you choose because there's a 25% chance you will be getting a good, clean, healthy baby boy, and there's a 25% chance of this couple getting a healthy baby girl. But, so where does this gender selection fit in then? All right, let's have a look at this scenario. If let's say the mother is completely unaffected, all right, so she has two good, clean, healthy chromosomes, X chromosomes. However, the father has the X-linked dominant disease in his chromosome. And of course, we assume that the Y chromosome is clean as well, all right? So how will that change the equation? Okay, let's have a look at each case on a more detailed level. So, let's say if the mother contributes this side of a chromosome for this baby girl over here, and then the father contributes his X chromosome for this baby girl over here as well. Alright? Is this baby girl going to be affected? Yes, because it is an X-linked dominant disease. So what happens if this mother contributes the same chromosome for the second baby here, and then the father contributes the Y chromosome for his baby? Is it going to be fine? Yes, he will be fine because this baby boy has avoided the problematic X chromosome in his father. In the same situation, if the mother contributes this side of the X chromosome for this baby girl and the father still contributes the problematic X chromosome, then this particular girl will be affected. But on the last case, if let's say the mother contributes this side of her X chromosome for this baby boy, and then the father contributes his Y chromosome for this baby boy, then he will be fine. Alright? So by now you should realize that there is a certain rule of thumb if the father has an X-linked dominant disease, and that is to choose baby boy. Why? What's the mechanism? Because we want to avoid the problematic X chromosome in the father. Okay? Alright, so it seems like, a head-scratching case, but it really isn't. So the rule of thumb is to avoid the X chromosome from the father, and when he gives up the healthy Y chromosome to his child, then all of the baby boys would be fine. So in this case, if let's say we run into this couple, what we will do is we will send them to IVF. Okay, we will strengthen and condition their fertility health, and hopefully that they will be able to make it through IVF process. And we need to do embryo genetic selection, which is called PGS. And mainly there is a shortcut, which is to choose baby boy. All right, you don't really have to have a very high-tech next generation sequencing machine to select specifically for X-linked dominant. No, you can have a shortcut just to choose the baby boy, but that is to assume that they are not carrying any other diseases. All right, so in that case they will be avoiding the disease, the genetic disease, by choosing gender male babies. All right. Okay, so what is an example of such disease? Okay, so the two reports that we received consecutively indicates the G6PD deficiency. So what's G6PD? It's weird. All right, so G6PD is actually an enzyme, and it is a very vital enzyme to create red blood cells. So when you have G6PD deficiency, what's going to happen is that the red blood cells will be breaking down or melted away faster than red blood cells are created. Okay? So in this scenario, what's this going to cause? It's going to cause anemia. Anemia in general means that you don't have enough red blood cells to supply oxygen to wherever your body needs it. Okay, so we have received two cases whereby one of which the wife, the mother's side, so-called, she has the X-linked dominant disease in G6PD deficiency. So we asked her for more information about her medical history, and she claimed that she has fainted twice, once after some intensive exercise and another time she drank some alcohol. So in that case, it really fits with the clinical characteristics of anemia in general. Plus the fact that she always claimed that she feels tired, sleepy, and that is just an enhancement to the claim of anemia. But the second case was that the father or the husband has actually gotten this X-linked dominant disease in G6PD as well. So I asked him, okay, sir, have you, faced up with any conditions such as being tired, sleepy, something like that? Yes, he said, yes, I always feel sleepy, I always feel tired, very easily. So that once again fits with the clinical characteristics of having G6PD deficiency. So I advise these two clients to immediately, if possible, to see a specialist. But both of them said, Adam, it's okay. We have already, it's okay that our lives are not being really affected by anemia. Okay, just feel like we are a bit tired only. So then, okay, it's okay if you don't want to see a specialist right now, but at least take some iron supplements. All right. Use lifestyle controls to manage the symptoms, such as having light exercise. Try not to do too intensive exercises such as Tabata or even high performance cycling, running, sprinting, something like that is not very good. Okay, and also to avoid any caffeine, for example, which will further stimulate the body. Okay, and then all these stimulating food should be avoided as well. Okay, so in that case, for the affected person, what are the treatment options for them? Okay, to be really honest, there is no such thing as a complete treatment for genetic disease, whether it's anemia, muscular atrophy, Huntington disease, the shrinking of the brain, something like that. So the only possible ways, which is more like a fiction than a reality, is to replace the mutated gene. Okay, but this is definitely one of the research area that is still ongoing. Okay, so it's called the gene therapy, which is to pull out the problematic gene and replace a healthy gene into it. We can also do the mutated protein replacement, so it's called the protein replacement therapy. So instead of pulling out the problematic gene, so gene creates protein. So at the protein level, we do a replacement. And then sometimes we can use diet modification, pharmacological agents to do metabolic dysfunction control. We can, if you are more aggressive, we can do an organ replacement, which is what I will be talking in the next talk about some lung problems that are caused by the genes. Okay? But obviously, these are very difficult treatments which nobody wants to go through, and they are really expensive. So the most prudent thing to do is to prevent genetic diseases from happening. And you can do that via genetic testing and genetic counseling. So at Verdure Healthcare, we have something called the pre-pregnancy DNA screening, which will consist of screening all the 23 chromosomes that you and your spouse have, and also include the 500 most common genetic diseases in Asia. Okay, so why do this kind of genetic testing? Because according to the University of Chicago, back in 2015, they say that humans carry 1 to 2 lethal recessive mutations on average. And when that happens, when humans carry on average 1 to 2 mutations, that if inherited from both parents, now let's pause a moment because this is talking about recessive diseases, okay? It can cause severe genetic disorder or death before reaching reproductive age, report scientists from the University of Chicago and Columbia University. So these two universities linked strong hands together, and back in 2015, that's what they claim. And even then, like what I mentioned just now, these are only about recessive diseases. So the talk that we had just now is on dominant. So X-linked dominant, autosomal dominant diseases, plus autosomal or sex chromosome recessive genetic diseases, all of them add up together, it can cause a whole flora and fauna of genetic diseases that we could be carrying in our body. So in Malaysia, the Specialist Center has actually published this article, and that scares majority of our parents' mind. So yearly around 16,500 of Malaysia's 550,000 babies are afflicted with congenital abnormalities, and about 1/3 may succumb to these illnesses before reaching their first birthday. So in summary, that means every 30 babies, there will be one that has been affected with genetic disease. And within that statistic, 1/3 may die before their first birthday. And that is something really scary, and we have to take care of. So fortunately, with our pre-pregnancy DNA screening, parents can get tested before even getting pregnant. So the first part of the report, like I mentioned just now, is to screen all 23 of your chromosomes. Okay, and we will see if there is anything deleted from a chromosome, anything duplicated unnecessarily, anything that has been inverted, substituted, or swapped around. So for every piece of chromosome, these are the 5 investigations that we will be doing, and that is only part 1. For part 2, we will dig deep into your chromosome. So as you can recall just now, chromosome is only the big picture, and we have to dig in order to see the DNA and the genes. But this technology is extremely complicated and it is extremely high-end. So I'm not going to go into details with this because it will take at least another day for me to explain the process. But anyhow, let me show you a sample report. So this particular client over here has actually carried 3 diseases: beta thalassemia, which is another kind of anemia, Smith-Lemli-Opitz, and Wilson's disease, which affects the liver. So these 3 diseases that this is a female client, is carrying in her body. Alright? And luckily her husband isn't carrying any of these diseases. Instead, her husband was carrying muscular atrophy and then Huntington disease, which couldn't be matched up with the 3 that she's carrying. So in that case, what we can do, we can advise this client is that they can actually go with natural pregnancy because none of these recessive diseases match up, and the worst case scenario is that their babies will be a carrier of all 5 of these diseases, but at least their offspring will be healthy and unaffected because he or she is only a carrier. Okay, so the main point of doing such genetic tests is to, of course, assess the risk. If, let's say, the mother and the father is carrying the same disease, there is a 25% chance of the baby being affected. All right? Okay, but all right, with all these genetic tests, they have to be analyzed by a professional. So let me show you what qualifications should a genetic specialist or a genetic counselor have. First of all, he or she must have a medical base. Okay, it can be a doctor, it can be a medical scientist, or even a laboratory technician. For me, I have a postgraduate certificate in surgery from the Royal College of Surgeons of England. So I'm initially qualified as a surgical instructor, but I don't teach surgery. Instead, I focus on genetics. So even with a postgraduate certificate in a medical background, you still have to be trained. Okay, so I am a certified geneticist from Stanford University, but since we are following US rules, we have to follow them to the end. Because according to US regulations, any geneticist that wants to offer genetic testing has to be further qualified in that specific field. So I'm certified by Harvard Medical School in genetic testing and the sequencing technology. Moreover, I'm also certified as a genomic data scientist from Johns Hopkins University. So pulling all these skills together, as you can see, there is no single qualification that can help a person to become a genetic specialist. So this field is rather complicated and you have to be highly qualified. And then one more thing I just want to mention here is commercial DNA tests, all right? So commercial DNA tests, how they work is that you go to the website, order a test kit, they will send you a test kit just like the COVID-19 antigen test, swab your saliva, put it into the tube, send the whole thing back into the headquarters, and they give you a result in approximately 3 weeks. But these tests are only good for well-being, sorry. So these are only for healthcare and general well-being kind of like genetic tests because they are not clinical. For clinical genetic tests, they have to be at least 99.9% accurate, which is what our pre-pregnancy DNA screening are. Okay, so more importantly, the difference between clinical and a general genetic test is that for clinical genetic tests, there is a medical follow-up that has to be done, such as the fertility solution, Or worse, if let's say the X-dominant kind of diseases, we have to address your disease immediately. Okay, previously we have sent a client to cardiology because he has familial dilated cardiomyopathy. So we have to address that problem immediately first before we talk about fertility solution. Okay, so once the genetic test has been done, okay, so whether or not you should be going for IVF, you should enhance the quality of the sperms and the egg cells. And with that, we have won the Reader's Choice Award from Baby Talk Mama Papa magazine for 2021 and also 2022. Thanks for all of your supports. So with our VHC female 1 and female 2, which is to enhance the ovulation function and also the quality of the eggs in ladies, and our VHC formula male, which is to enhance the sperm quality and quantity in guys. And also we have the confinement, also called the afterbirth recovery supplements for you as well. And all of these have gone through a strict Reader's Choice Award kind of selection, and we are very lucky to be awarded with this. And also, Verdure Healthcare, over the past 18 years of work and also of service, we have been awarded with super brands and for both 2021 and also 2022. So I would like to also use this opportunity to thank you everyone for your kind support, and we are very looking forward to serve you for years to come, because now Verdure Healthcare isn't just serving infertility couples, we are serving the couples that are concerned whether they are carrying any kinds of genetic diseases. So, with that being said, okay, we hope that there is a takeaway. One final word of advice is that your genes will determine your baby's lifetime health. So if you're currently planning to get pregnant, or if you're worried that there is anybody in your family that has genetic diseases and you might get an inheritance from them, please give us a call, because our talk right now is just to give you some quick tips and advice. Hopefully that will also give you some proper education about genetic diseases. But when you are really planning to conceive, there's quite a number of information that we need to advise you on. But don't worry, we will make it simple and easy to understand for you. And we are very looking forward to hear your call. Thank you very much. This video will be put onto YouTube, so kindly share this video to the friends and families that are planning to conceive. And I look forward to see you soon in the next video. Have a nice day.